Good evening, everyone.
Hello, Assembly member. Yay. Welcome back home from India.
Yeah,
A little meant for every fight.
How were the weddings?
they're amazing. James isn't so far off. I almost did have to do this from a plane or an airport because we almost didn't make our transfer. And like they had to hold the plane for those of us that were on that regular flight because it was late. It was one of those very close call transfers. So when we arrived, the other flight had already started boarding the flight to SFO, and so it was touch and go for a moment, but we made it, and here I am.
Were there elephants at the wedding?
No, there was a lot of other stuff though. I mean, it was pretty cool. There's a lot of fireworks and stuff I don't normally see at weddings here in the States.
I got to attend the wedding in India once, and you're right. They are amazing. Well, welcome. We will go ahead and get started because we know you must be tired. Welcome everybody to the Healthcare for Us general meeting. I'm Erica Ferriston, the chair, co-chair Gina Viola, and if all the board members would please give a quick wave so you can be seen and acknowledged. This is our amazing team. I also see some representatives from some amazing groups. I just want to highlight. I see API for CalCare here tonight. I see Black Lives Matters California. We've got White People for Black Lives, our Educators for Single Payer. Hello. Hollywood for CalCare. Who doesn't love Hollywood for CalCare? Socialists for CalCare are also on here. And I am seeing some, it looks like some candidates are here. I think I see David Kim. I think I saw Baba Akili. So anyway, if you
And Erica, not to forget Arturo Cabron from Medicare para Todos.
Yes, Arturo Medicare para Todos. I was gonna say, if you are here representing a group, please drop it in chat because we want to acknowledge you. We appreciate you. I think I see Isabel from Indivisible West. So welcome everybody. We're so happy to have you. And with that, I'm going to turn it over to Assemblymember Kalra, who is our patron saint, who is the author of CalCare. And Assemblymember, take it away. Tell us, what's different about AB 2200 than what came before it, and then maybe we'll open it up for some questions. So, thank you for being here.
Erica, thank you so much. And when I look at the list of folks that are here in attendance, I mean, you all are warriors. You've been in this battle for so long, so many of you. And for those that are newer into the battle, you will find inspiration in some of the folks that are part of this group, because I think the reality is that we know when it comes to this kind of battle that it takes the kind of persistence and determination of people ultimately that are in every corner of the state that are not willing to stop, because if we stop, that's what the industry wants. That's what that's why I think over so many years it's been very difficult to get a single payer bill through, is that naturally folks ebb and flow into involvement in organizations. But with the core that I see here, as well as others that have been rallying around the state, I think that we have a unique moment. And I think that unique moment is certainly kind of brings together what we've experienced through the pandemic, brings together what we've experienced, the Black Lives Matter movement, brings together what we've experienced in terms of seeing the incredible, enormous amount of wealth that's been created, even through the pandemic, and yet people are still left homeless and struggling. I saw a graphic today that the Bay Area's economy, the GDP of the Bay Area, is larger than 45 other states. And of course, as we hear that very commonly, California is the largest economy, approaching the fourth largest economy in the world. And I don't think any of those things are things to be proud of. Not when you have people living in the street, not when you have people that don't have health care, not when families going bankrupt because they don't have health care, not when people are struggling to pay rent, not when people are making decisions at the kitchen table as to whether they pay for medication or pay for food. That's not a sign of a great society when you have that much wealth hoarded by the very few. And the very few include the insurance companies, includes those that are profiting off us from the pharmaceutical companies. Those are the ones that are profiting from this expansive economy. And yet the average everyday worker is the one that's suffering. Now, I'm in a little bit of a mood today because not only was I in India about 30 hours ago, but towards the tail end of the flight, my father got ill the final hour or so, and it was pretty scary. Got met by paramedics at SFO, and I went in the ambulance with them, and they took him to Stanford. And I'm not mentioning that to garner sympathy, but to really just say that, look, it's the 5th time that my dad's been in the hospital in the last year, and he's getting great care. He has, whether it's a Good Samaritan or Valley Medical or Stanford. We have great nurses. And in fact, on the plane, by the way, they made the announcement over the intercom. If anyone, if there are any medical professionals on the plane, let us know. And 2 wonderful German nurses, we were coming from Frankfurt, came to the rescue, and they were phenomenal, along with the flight attendants. And but I bring this up not only because it's on my mind right now. My father, after this, my brother's at the hospital with them right now, but they go back right now or early in the morning, depending on what the situation is. But look, he has Medicare, and they ask that when they always ask what the insurance is, and when you say Medicare, it's green light. They're able to continue forward because they know they're going to get the compensation they need. But if the answer was different, or if it was someone that didn't have insurance or had substandard insurance or had Medi-Cal, who knows what kind of response would have occurred or what kind of conversation would have occurred in terms of, these are the options that you have. Or if you think about the families that have gone through that situation before and had enormous copays, or, were on Medi-Cal and were left with extra bills that, they couldn't pay, or put them on the verge of bankruptcy. And now they're sick and they're making a decision. Should I go to the doctor or not? Should I call 911 when I know that a family member of mine is in distress? Should I go to the dentist, even though I know my teeth are sore or hurting? I don't want to hear that I need a root canal because I can't afford it, right? And those are the real day decisions that are happening. Those are the decisions that are happening every day by Californians. And so it just reiterates with me how urgent this is, because these are things that are happening to people every single day. And as mentioned, yes, 50% of Californians delay care. We know that. My father's done that because Medicare doesn't pay for dental and vision, and will time when he has to do things, right? That's very common. It shouldn't be. It shouldn't be the norm, but it is. And so I'm very excited about AB2200. And frankly, in terms of what's different, look, AB1400 was a fantastic bill. The text was phenomenal. I think we've been working with the nurses. We've only built upon it and getting feedback from folks. We're hearing folks, adding a physician to the CalCare board. I know that was a big interest of the physicians for a national health plan, and CMA and others that indicated that. Great, we agree. Let's have a physician on there. That makes sense. It wasn't that it didn't. 1400 did not prevent that from happening, but it didn't explicitly say it. Well, now we're explicitly saying it, because yes, we should have a practicing physician on there in addition to nurses and other practitioners on the CalCare board. We're reaffirming in the text gender affirming care to make it very clear that CalCare is about gender equity. It's about equity for all Californians, regardless of whether they're binary, non-binary. We want to make sure that everyone, and California has been great in that sense in terms of being a haven for folks around the country, transgender youth. We want folks to come here and know that they feel safe. But we also want to make sure that they know they have healthcare too, and that their services will be provided for. We have added more in terms of ensuring that an advisory board, for example, or on health trusts and pension funds we want to make sure that our union brothers and sisters know that this is a journey and a battle that we need to walk arm in arm in. Because if you look at the last few decades, as much, and in fact, even the last couple of years in particular, it's been wonderful to see the hot labor summer turning into hot labor winter and all these wonderful victories that are occurring. But the reality is, if you look over the last several decades, one of the areas where union members are paying more and more, and all workers are, but I mentioned union workers in particular because they fight very hard to collectively bargain and fight hard for those contracts. And even with that, so much of that bargaining goes into healthcare costs because we don't have control over it. So we're basically giving away hard fought battles, hard fought wages and benefits earned to the profiteers. We're just handing it over to them, where it really should be going to the worker. One thing that I recall Sarah Nelson from the Flight Attendants Union saying, what we legislate, we don't have to negotiate. Well, that's legislate healthcare for everyone, high quality healthcare for everyone, and then go bargain for other things, bargain for more days off, bargain for more vacation days, bargain for better wages, bargain for things that you should be fighting for every single day, but the healthcare costs and fighting for that distracts away from other aspects of what these unions can be fighting for. And so, ultimately, this legislation is about moving the ball forward, having a real, actual policy bill that we can move forward. Because one thing that folks say is, well, constant question, how are you going to pay for it? And what I say to them, first of all, right now we know at this point, our healthcare system is over $500 billion a year in California. And we know that is while people are dying without, because they don't have access to healthcare or delaying care, ending up in much more severe illnesses or death or higher costs. We know that family bankruptcy is still the #1 reason for bankruptcies for families. We know the unhoused, so many of the unhoused, and particularly the elderly unhoused, are becoming unhoused for the first time because of health issues that come up that they don't have the ability to pay for. And so we know all this to be the case. And so when folks say, how are you going to pay for it? First of all, the question should be, how are we paying for it right now? And with whose lives? How are we paying for our system right now? That's the question that you should ask back to anyone that says, how are we going to pay for single payer? Secondly, we are following the process that has been put out by the federal government. The federal government does not tell us or any state when they're doing federal waivers, hey, how are you going to pay for this before you apply? No, that's not how it works. You apply first, you get the waiver, and through that process, you determine through that process how much you're going to need for that delta between what the state and federal government's already paying into the system and what else you're going to need if you get rid of co-pays and premiums and individual pays and all that. And then once you have that number, then we can have 100% of our attention devoted to how we pay for it, rather than having folks gaslight us and tell us that we need to come up with that first when it doesn't even make sense. And it's not the process that was put forward by President Obama when the Affordable Care Act was put forward that allowed for Medicare waivers. And so, we know that we have every opportunity to move this bill forward so that we can get to those other tough questions and make sure that we're doing it in the right way and make sure that, we're not leaving any aspect of this unresolved. And that only happens when we get a quality policy bill like AB2200 to the governor's desk, signed, waivers applied for, and then that's when the vigorous conversations with the federal government come, and ultimately with our voters and our constituents come as to how we're going to pay for the delta. Again, we are, over 2/3 of our healthcare, at least at this point, is paid for already by state and federal funds. It's that remaining amount that we have to go get. And so anyone that tells you that our current system is affordable because we have access, because people have insurance cards, doesn't tell the story of what families are going through. And so anyway, I'm very excited. The other thing that's different now, by the way, as we know, is the membership of our legislature. It is one of the reasons we've discussed this many times before, to the chagrin of many here, as to why I delayed the vote, because we didn't have the vote. One thing I did say very clearly, this next election cycle, we have people running right now that I believe are going to win, that are going to be champions, and that is proven to be the case. And so now we have to make sure we get the votes to get it through the committees. Healthcare Committee Chair Mia Bonta, a fantastic supporter of single payer over many, many years. But others that we've seen come on board, Corey Jackson, Damon Connolly, and Isaac Bryan, Tina McKinner, and on and on. We have folks that are newer to the legislature. Liz Ortega, newer to the legislature, but not new to this fight. And that's what gives me more confidence than ever that we're going to be able to get this done.
Wow, thank you so much, Ash. I mean, like, how did you get those 19 co-authors? That's what I want to know.
Yeah, I mean,
Talk about that.
yeah, it's, I think that people instinctually, our colleagues are, they are in favor. First of all, they know. I mean, I think it's very disingenuous for any one of my colleagues or anyone, frankly, if they put any time into this, to not understand that our current system's unsustainable, that it's broken. And when you start with that position, with an agreement that, okay, our current system is broken, then the question is, what do you do next? Now, the single payer, single payer healthcare is not new. It's something that's been around for a long time. We see it in different forms around the world in different countries. And I want to make clear when I say that as well, we're making a single payer system for California. We're doing it for ourselves, for California. It's going to look different than other countries. It's going to be better than other places. I truly believe we can do that because we're putting so much in our healthcare system, more than those other places. If we can concentrate that into one single payer system, then we truly don't have to have the horror stories that I know are embellished many times over from other nations. But that being said, how I got the co-authors is simply just asking them, and I think that most of them are already there. They had a lot. I've had a lot of great conversations already with. I've already talked with over a third, or around a third or so, I believe, of our Assembly Democrats, and I'm going to keep having conversations. But I think that they know that enough's enough. They know the time has come, because every year that we delayed, they're seeing the numbers, they're seeing the pain. And by the way, and when I see that, I mean, as a legislature, all of us have done some really good things to get us closer. When you expand Medi-Cal to undocumented immigrants, that gets us closer to single payer. And because we're investing even more money from the state. But what our colleagues also know is that Medi-Cal is incomplete access to healthcare. So they know that, okay, I like the fact we expanded it to undocumented, because no one should go without access to healthcare. But I also know we expanded it to Medi-Cal, which means they're not getting all of that access to healthcare that they would get if they had a different kind of insurance. And so I think folks are learning more and more about it. And so when I've talked to my colleagues, again, they have great questions. And by the way, there's some folks that haven't agreed to sign on, but have said that, yeah, I support it. And so look, at the end of the day, we need votes. We don't need 80 co-authors in the Assembly and 40 co-authors in the Senate. We need 41 votes and 21 votes. And so I think having that number of co-authors out of the gate, though, is very encouraging. And it sends a signal to other colleagues that, look, this is the direction that we want to go as a legislature. This is where, when you get that many colleagues on board, it really sends a signal in a very positive way. And I hope it sends a signal to the community and to folks out there, to activists and to the industry even. And because I'm going to meet with everyone. I'm going to meet with CMA. I'm going to meet with all the folks that have traditionally been opposed. But I think we can start moving. When more and more doctors are on board with single payer, that's eventually going to start to move CMA in a certain direction, if not in support, maybe still opposition, but maybe there's some things we can work on, and that's okay. Look, at the end of the day, we know what we're fighting for, and we know that what we're doing is not just for healthcare justice for everyone. It's for the doctors. It's for the nurses too. It's for them so they can actually have dignity in their work, not be on the phone with insurance companies all the time. And so saying all that, those are the kinds of arguments and some of the other things I've said that have helped get my colleagues on board with the co-author. But quite frankly, most of them were already there the moment I asked, or the nurses asked.
That is incredible. Yes, we are so impressed with all the work clearly you've been doing behind the scenes, because that was amazing. We want to open it up to some question and answers, if you are okay with that. And before we do that, how long do you want to hang out with us?
I can hang out. Yeah, 15 minutes or so before I pass out.
Okay. Okay. So we'll keep an eye on the time and we'll go ahead and open it up from questions. So folks can go ahead and raise their hands and I'll do my best to go in order. James S., go ahead and unmute and ask your question. And I do just want to say to everybody, please get right to your question so that we can have as many questions as possible. Thanks.
Okay, Ash, you're going to need some sage tea for this. As I see the legislature now, you've got SB 770, which is signed into law. So a lot of people on the ground just see us as noise, trying to do the same thing. How would I best describe the relationship between the two? SB 770 has been signed into law, and a lot of people aren't even looking at us. What's the best way to discuss that relationship?
I mean, I would say that even the author of 770 said that it's not inconsistent with the policy bill like CalCare going forward. And he's been supportive of single payer and CalCare. And so I would say that, you know, out of the author's mouth, so to speak, and if you look at the bill, it actually really doesn't do anything to prevent or discourage a single payer policy bill from going forward. In fact, the final version of the bill simply tells the governor, the administration, hey, come up with some waiver process to start having conversations with the federal government. Okay, great. When we pass CalCare, they'll be, you know, I guess already ready to do that. That's fine. It doesn't hurt anything. I think that the only way it hurts is that folks have the impression that somehow that, you know, it is a step that makes CalCare not necessary at the moment, and that's simply not true. So I would simply say that even the author of the bill and those that were advocating for it said that it's inconsistent. It's consistent with AB2200 with CalCare, and that there's nothing in the bill that at all says that a policy bill cannot or should not go forward. And so we move forward, and that bill, you know, we'll have some report back from the administration at some point. Okay, that's fine. And hopefully it'll help get the administration closer to a position of supporting CalCare.
Thank you. The next hand I see on my screen is Constantine, one of our favorite candidates on here. Go ahead, Constantine.
Oh, great. Hi, Ash. First off, thank you for putting the bill together. And back in 2020, you came down to Burbank and helped me canvass in Magnolia Park. That was fun. I did get elected that year, so I appreciate you helping me out. I couldn't see, I'm running for LA County Supervisor to represent 2 million Angelinos. One of my opponents, Chris Holden, the assembly member, has not signed on to the CalCare bill yet. Is that correct? I haven't seen his name attached to it.
Not yet, but you know, I'm hopeful.
So I'm going to throw this at you, and I hate to do this to you. Would you consider endorsing me and changing your endorsement to put some pressure on him before March 5th?
I don't, you know, look, I'm not here to get political on who's supporting.
Right, think about it. I'm just throwing that out there. Just put some pressure on him.
Like you said, Constantine, I did support you in the past. I didn't even know you because of you know, strong recommendations of folks I knew in the area there. But you know, I'm confident that when I have to be, look, I'm confident when the time comes that I believe Chris will be supportive of the bill, regardless, again, of whether he co-authors or not, because look, we need 41 votes. And so I want to, you know, I appreciate so many candidates like yourself that are running, in some cases running against colleagues of mine that are very, very kind of forcefully and appropriately in favor of CalCare. And I really do appreciate that. But my focus, you know, more so than anything, is getting my colleagues that I'm serving with in the moment to help me pass. I do appreciate you being direct as a candidate should.
Well, I'll keep the pressure up down here. Thank you for what you're doing. Appreciate it.
Thank you, Constantine. One of the things that I love about our meetings is our questions are uncensored. Okay, so next, Cheng Sim.
Yes, Assemblymember Kalra. What kind of talking points have you heard this time around for AB 2200? from the people who might be reluctant to vote for CalCare? Have you sensed that there is some talking points that people are coalescing around? We, as grassroots people visiting our legislators, we've heard a few. One of those being SB 770. That that SB 770 is proposing a study, and that's going to be the deadline for that is 2025, and therefore they want to wait. So they are using SB 770 as an excuse to say they're not gonna decide on whether they're gonna vote for CalCare or not. So that's what we're hearing. That we've also seen indications that the insurance industry is pivoting to a talking point that CalCare, when implemented, will eliminate Medi-Cal and Medicare, because in the past, they tried to fearmonger about CalCare eliminating Kaiser Health, but now that the updated AB2200 updates and makes explicit that people's Kaiser Health will continue. It's only the insurance part that's removed. There seems to be some indications that they're going to say that fear-mongering tactic now is elimination of Medicare and Medi-Cal. So those are the two things we've encountered. Wondering if you have encountered, other sorts of arguments.
Yeah, I mean, I think the how do you pay for it one comes up, and it's a very important question. Like I said, it's one that needs our full attention at the appropriate time. And the way that the waiver system is set up it allows for more engagement with the federal government once a policy bill is done. And so the way I foresee it is that we can start having working groups and internal conversations on financing. That's not a problem at all. But putting forward legislation, not knowing how much we're going to have to bring into the system is contrary to how the federal government asks us to do our work. And then I would also say, like I mentioned 770 in terms of how to respond to it. And so and so as mentioned, that you can't pursue waivers before you pass a policy bill. But that being said, look, I would just not, when it comes up, just say, look, there's nothing about 770. And again, even those that were promoting it, the author himself was a co-author of 1400. It was very clear in saying 770 is not meant to delay any policy bill. And in terms of Medi-Cal, look, first of all, Medi-Cal, yeah, I mean, CalCare will replace Medi-Cal because Medi-Cal is an incomplete and an unjust, form of insurance or of coverage. It's a good thing to have as a safety net, but the reality is that it's not enough, and we know that. And it's not getting rid of Medicare; it's boosting Medicare. Look, we can't even do this unless we get a Medicare waiver. To get a Medicare waiver, the federal government has to ensure that the program being placed does not in any way take away any current level of care. It's got to either be the same level or more care than what is being given through the federal government Medicare program. That is written in the Medicare waiver process. And so when someone says replacing Medicare, they're trying, it's pure fear mongering. The reality is that it's boosting Medicare to a level where it really deserves to be and needs to be. And so CalCare is really a platinum level of Medicare that everyone should be able to have access to. It's a level of Medicare that doesn't even exist because it adds so much more in services.
Thank you. Nick, I see your hand. Before I call on you, I just want to check with our board member, Scott, if there are any questions from Facebook. If there are, Scott, just give us one.
Nope, we're all good.
Thank you. Okay, Nick, and I want you to know the assembly member is going to leave soon. So if you can just get right to your question, that would be great.
Sure. Hello, Representative. Thank you for coming out tonight.
I was wondering specifically if there was like a backup contingency plan in case the federal government doesn't like approve the waivers, or if there's a way perhaps that the state can create like a stopgap measure in that situation. Because New York, I think it's single payer bill says that irrespective of whether the federal government sort of approves the sort of the waivers, there would still be a plan to create a single unified health system that would be based purely on state funds, and also like other like stopgap measures such as like significantly like reducing like some of the worst effects of like medical debt, such as like banning credit reporting, things like that, or limiting the amount of lawsuits that like states like Colorado and New York have done. And I was wondering if sort of in the absence of sort of the federal government being very, because the federal government's sort of its own beast, if a lot can be done on the state level to really sort of usher us in to creating like a fully single unified system.
Well, I'll say we've been doing a lot at the state level, expanding healthcare, putting more into it. We're looking once again at Medicare, Medi-Cal reimbursement improvements, which is good. But that being said, look, and I went to New York and I spoke with the author of one of the long time, the godfather of Medicare for All there, of single payer there, and we did talk about how they have a program where Medicare is kind of carved out, and I don't think that's ideal. For a couple reasons. One is, what we're trying to create will create services that are beyond Medicare. And so if you carve out Medicare, now Medicare becomes a substandard form of care to what we're trying to create with CalCare. But secondly, by doing that, it's not, you're removing the benefit. And this is really an important point. And one of the reasons why I brought up, and I forgot to mention it, when I brought up with helping my dad and all the visits he's gone to the hospital. Remember, the reason why Medicare is it's loved by those that have it because it covers everyone. And let's set aside the areas like dental, what have you, that it's not covered. But it's easy. You go there, you have a medical card, good. You're going to be taken care of. Now, we also know that Medicare covers the most expensive patients in our country. The folks like my father, like so many other fathers and grandparents and grandmothers that are going to the hospital a lot, going to the doctors a lot. And so the way that a single payer system can work effectively is by bringing everyone into one pool. So the folks that are in their 20s and 30s that don't go to the doctor as often, that don't go to the hospital as often, are also collectively paying into the system so that it's there when they get older. It's how Medicare is designed, but we have to expand that to our entire 40 million population to benefit from reducing pharmaceutical costs, to benefit from reducing administrative costs. Otherwise, you're still going to have two massive administrative systems, a Medicare system and a CalCare system. So I still believe everybody in, nobody out is the most efficient, effective, and moral system that we can do. I really do appreciate what New York's doing, and if they're able to do it, that will be a huge step forward nationally in terms of creating a single payer system. But I think that going the Medicare waiver route is harder, but it creates a more sustainable long-term solution in terms of our healthcare sustainability and healthcare justice.
Thank you. It looks like we have time for one last question, and it's Sheila Goldner.
Hi, are any of your co-authors Republicans?
And I don't expect, I'll be hopeful and I'll reach out to them, but I don't expect any Republicans to even vote for the bill. But we keep trying, and my door's open to all of them, and I'll talk to them. But they're so lockstep with industry and get so much money from industry, and have shown, they didn't support for the most part the Medi-Cal expansion to undocumented immigrants. I'll be hopeful, and I'm just going to focus first on the Democrats that I believe we can get on board. But they're the ones that try to get rid of Obamacare, right? I mean, and what I will say to folks, they were unable to do it because once their constituents had the care, it's a lot harder. It's a lot easier said than done to take away when people are finally getting some of that health care that they, or some benefit they weren't getting before that they deserve. And so that I liken that to some folks saying, you know, there's another aspect of the question, which is important in the prior question as well, is that people say, what happens if Trump wins, if there's a Republican in the White House? Look, first of all, we can never advocate and fight for something that we know is morally right and just, not to mention fiscally right and just too, based upon who's in the White House. We just can't. You know, Dr. King didn't do it. I think Senator Chavez didn't do it. You've got to fight for what you believe is right and build a movement behind it, no matter what. But I also say, look, Trump tried to get rid of Obamacare and he couldn't do it. Trump tried to pass, working with other state Republican governors, waiver programs that reduced the benefit available and wasn't able to do it. So the waiver program is a strong program that has been upheld by the courts. And so, you know, obviously, you know, if Trump's in the White House, we'll have to take a look as to what our strategy is going to be and whether it should be something different. But this is not about Trump. It's not about Biden. This is about healthcare justice for Californians and ultimately all Americans. And we can't wait until we have the best administration or not to do it. And by the way, this administration, it was his Secretary of Health and Human Services, Javier Becerra, who had his people meet with me extensively on this. And so, you know, there's great reasons to be encouraged, but I do think, you know, making sure we have a Democrat in the White House obviously, you know, paves a smoother road and a timeline that will be, you know, sooner rather than much later if there's a Republican in the White House at any point.
My assemblyman is a Republican, Greg Wallace. So
Thank you so much, Assembly Member, for spending all the time that you did. I know you're exhausted. It just really shows your dedication. Anyone else would have said, I'm flying in from India. I'm going to be jet lagged. I cannot do it. You said, well, my flight gets in the afternoon. Your meeting's at 7:30. I'll be there. And so we just so appreciate you and thank you. And Reggie and Arturo, I know you had your hands up. So drop your questions in chat and we'll send them to the Assembly Member to get answered and we'll get back to you. But thank you so much, Assembly Member.
Everyone.
And much love to your dad. So many messages in the chat. We're all holding for his healing. So have a good night. Okay, for everybody else on the meeting, again, sorry that we couldn't get to everybody's questions. They were all such great questions. I'm seeing other great questions being dropped in the chat, and Maureen and our board members, I think, are doing a fabulous job of answering them there. A couple of things to get to before we close. So we only have a few months to get this bill passed. So the next big legislative deadline is getting this bill passed through the Assembly Health Committee. And we have until April 26th to do that. So we really encourage you, if you haven't already, to connect with the California nurses. There are all kinds of actions that they are doing, district leader meetings on your own. You can call your assembly members, set up meetings. But one of the things, and I will turn it over to Gina, that we're all doing is hosting a CalCare party during the weekend of March 16th and 17th. So Gina, can you talk to everybody about that?
I do see a couple of raised hands, so I didn't know if Reggie and Carol, Reggie, was your hand still up for the Assembly Member, and Caroline's hand is up as well.
Oh yeah, sorry about that. Let me lower.
Oh, okay. Thanks, Reggie. Caroline, did you want to chime in? Can wait. Okay. So yes, we're going to drop some information about how you can host a party on the weekend of action. It's actually quite simple. It's just a matter of inviting a handful of friends over and talking CalCare, and you will get support on how to do that. So please take a look in the chat and sign up to host one. I know that I'm actually going to be out of town the weekend of action. So I'm going to do mine on Monday night. And I've already got my invite out to my community, because that's really how we're going to do this, is by, growing the communities that are participating in this with us. So it's not just the same folks that these legislators see over and over again. We want them to see more of us. So thanks all.
Yeah, so I'm just curious if you guys can drop in the chat how many of you are already signed up to host a CalCare house party. Maybe drop your like a thumbs up in the chat. It is technically, okay, great. I'm seeing like on it. It is technically Saturday and Sunday, but if you can't do that, you can do the Friday the 15th or that Monday. As Gina said, she's out of town, so she's doing hers on Monday. Again, this is how it's boots on the ground that's going to win this. We'll never have enough money to compete that way. So it is people power. And as Gina's saying, maybe she can drop the link again. It's literally, you can have 5 to 10 people over. The nurses will give you agenda that's like, for the first 20, 30 minutes, have a potluck, make small talk. Here's a 10-minute film you can show. Really simple, easy stuff. And this is what we want to do. We want to take action. So Gina's dropped the link again. So if you're not already signed up, please sign up. I do see a couple of hands raised, and I'm assuming they're not for the assembly member since he's been gone. So go ahead, Leah.
I just wanted to say that it's another thing that makes it even easier to do a house party is that they're doing trainings. So I'm signed up for training in just a couple of days on the 21st. So I don't really have a link for that, but you probably do. So if you
that's a good point, Leah. That the link that we're dropping, once you sign up, they'll send you the information for those trainings. So that's a really great point. So keep, I know I've asked for those of you who are hosting meetings to put a thumbs up. If you are going to host a meeting and click on the link tonight, put a fire emoji. Let's see how many people are going to host, because we cannot leave the assembly member alone to do this. We got to send some backup. Isabel.
Yeah, I was just going to mention, because someone said in the chat, oh, I have just a small apartment. Something that in one of the other meetings I heard that was helpful is that the house party doesn't necessarily have to be at your home. It could be in a restaurant, a public space. You could invite people to meet in the park. You can really hold it anywhere.
Yes, great point. Simple, easy, low key, not fancy, potluck, picnic in the park. You got it. So with that, does anybody want to say anything else or have any other questions before we close? Cheng Sim, and then Caroline, and then, okay, lots of hands. So Cheng Sim first. I saw you raise your real hand, Cheng Sim.
I just want to say really quickly, for the house party, it's a really, really great way to get people who are new to CalCare, who don't know anything about CalCare. It's going beyond the usual sort of, the CalCare movement people. We want to get friends and families, people if you go to a church or a temple, invite them, your friends and family members who are not, involved in the CalCare movement. It's a great way to get people in who are new to the movement, because we really need to grow it. We can't win if we have just the same numbers of people. We have to get new people in to back the movement and pressure the legislators to vote yes.
Yeah, great point, Chung Sim. You know, it's a great way to, if you have mom friends or gym friends or neighbors, again, you know, really small, casual, easygoing, and it's about getting people who aren't already in the choir. But if you got some people in the choir who want to come over, they'll help cheerlead your meeting. So that works too. I do see lots of fire emojis, meaning your guys are signing up tonight. Karima, Dennis, Paul, Peter, let's keep it going. Caroline.
Yeah, hi. Thanks so much for hosting. Hi, everybody. I'm assuming we're probably mostly Los Angeles area activists in this meeting tonight. And I was just wanted to raise the possibility of planning a CalCare March sometime maybe in like early April. I remember going to the March for like Medicare for All in like, I think summer of 2021 before I knew like anyone here. I just kind of went to it because I saw it online. So maybe that we could repeat that with lots of other people. And and then 2 years later, they're going to be CalCare activists. But yeah, so just maybe like something to keep in mind. We can talk about on email or whatever, but I think that would be really fun to do it in LA. I think we could get some people to come out. Yeah.
I love that, Caroline. Thank you so much. And Caroline is the founder of Hollywood for CalCare, and she is one of the Healthcare for Us partners. So we can put that on our website, Caroline. So yeah, just keep us posted, and then folks can come to hcforus.org and we'll have the information there. So love it, Caroline. Thank you so much. I'm seeing more fire emojis. Tim, thank you so much. Let's get 5 more fire emojis tonight. Okay, Arturo, Medicare para todos. Let's hear it. Can you unmute there, Arturo?
All right. Yeah. Hello, everybody. We organize here in a mostly immigrant, Spanish-speaking, and Korean community. My question is, do we have any material that we can give and we can organize around? That's my first question. The second question is that, you know, the Assemblyman was talking about we need 22 more votes. Are we at all like developing a strategic like campaign of are we going to target the 22 votes that we want to get to? And I would think that if we do that, we can whatever resources we have, whatever people we have, we can focus to make sure that, you know, when the vote comes up, we'll have the numbers. So those are my 2 questions.
Yeah, I see Chung Sim with her hand raised. So Chung Sim.
Arturo, CNA probably has materials in Spanish already. So we can probably get Spanish language materials from a CNA. They don't have materials in Korean, but we can put together a proposal to CNA to pay for a translator. But we want to have those materials created not just as a translation of existing materials, but to have those materials. I mean, even for the Spanish language materials, I would suggest that, you know, we work together to formulate our own materials, talking about why CalCare is so important for these specific communities, because, you know, there are more than just like a general CalCare. For the Latinx community, for example, the Korean community, there are specific reasons why people, you know, their percentage of coverage for insurance is fairly low in these communities. So there are very specific like Latinx and API reasons for why these communities need CalCare so badly. So I would suggest putting together a proposal, creating our own CalCare materials, and then putting a proposal together to the CNA and ask the CNA to fund us, creating these materials, hiring our own translators, and printing those materials. That's what I would suggest. And if you are interested, I think, we can talk about how we can put that proposal together very quickly.
Okay, thank you.
Thank you so much, Arturo and Cheng Sim. So we only have a few minutes before we close. I do see 2 more hands. So James, if you want to briefly ask your question.
I just, signed up for the CalCare thing, and I've got that going, and I've even let Phil Gavkes know about it. I think told Phil, about it. So it kind of might have some people come over and meet somebody, or, and just find out wherever it could be. It could be in a park or whatever. It doesn't have to be at a person's place.
That's right. Thank you, James, for signing up, and thank you for sharing that and making that pitch. Really, really appreciate it. Jiang.
Hello. Thank you for doing this. So we're we have a few weeks until the primary, and it's a great time to really pressure the candidates to confirm that they are going to support this bill, and to do it with, if possible, multiple people. But if you can't, then that's fine. So I spoke to one candidate. I had more leverage than your average person because I was appointed by Stonewall Democrats to be a delegate in the endorsement process. And so I got a candidate to commit to supporting single payer. And they were kind of hedging and saying, I don't really understand like all the intricacies of 770 and the other bill. And then this person even got Alex Lee to call me, and I was like, Alex, I need this I'm not going to endorse somebody who does not support single payer. So it's a very, very good time to pressure the candidates to pledge to support this bill.
Jiang,
And we are.
That's a great point. Yeah. The only time we have leverage with politicians is when they're candidates. So thank you for that. And I'm going to pull a Constantine. Jiang, can you get Stonewall to endorse CalCare?
You know what? I was I'm not that involved. I don't have that much pull in Stonewall. I wish I did.
Had a candidate to do it. Come on, make Stonewall happen.
I don't even go to the meetings.
Oh my gosh. Well, we'll talk offline, and
Okay.
you're going to start going to those meetings and get that endorsement. Thank you so much, Jiang. Really appreciate that. That is about our time for tonight. Really appreciate you all. This is what it's going to take, is people power. If you missed anything, you can find it on our website. We have all the links to take action. If you liked what you heard tonight, put a tax deductible 5 on it. Gina's going to drop the donate link in a minute. And just thank you all. And I want to thank our board. You're fabulous, amazing. And let's go Team CalCare.
Yep.
Good night, you all.